Thanks for tuning in for the fourth and final part of the study sessions with the Ivy League, and today we're covering IV rate calculations. Let's get right down to it. Alright guys, so today we're going to be doing IV calculations, and we're going to be doing 4 different applications of IV dosage calculations. So I'm going to jump right in, and the first one is going to cover calculating drops. And you might be saying, well, why do I need to calculate drops? Why would I ever need to do that? I'll just put it on a pump and type in the flow rate and the amount to be delivered and be done with it. And that's great. Pumps are awesome. We use them every day. The problem is you need to know what to do if you don't have a pump. If there's an emergency and you have to put something in quickly, or if your power goes out in your hospital and you don't have access to your pumps because the pump batteries have died. And I can actually speak to that one because we did have a power outage at our hospital and the backup generators were blown, so we only had 1 to 2 hours of pump life, so we did end up having to do this. So the first one, your patient has LR ordered. So the first one, the order is LR 125 milliliters per hour, which is a very common order. Okay, so this first one is a very common order. You'll see this a lot in the hospital setting. LR 125 milliliters per hour, which is where I work, used across the board for everyone basically, unless you have some kind of allergy or something like that. So the tubing drop factor can be found if you look on your package of your tubing. It changes and it varies based on the actual diameter and the length of the tubing. Basically what it means is how many drops that it takes in that little drip chamber underneath your spike where you put it in your bag, how many drops it takes per milliliter of fluid in there. So it's going to change. This particular tubing is 15 drops. I think piggybacks are, most piggyback lines, secondary IV tubing lines, are 20. Micro drips are 60. So it just basically depends on the size and what your facility uses. So it's going to change, but it's always listed on the package, always. So you can calculate this. So we need to figure out how many drops per minute we need to deliver this amount per hour. So the way we do this is we multiply So this is the way we set up this kind of problem. You want to put the volume to be infused here. You want to multiply that by your drop factor over here. And then you want to divide that by 60 minutes in 1 hour, because we're trying to get the number of drops per minute that we need to calculate. It would be darn near impossible to calculate the number of drops per hour, but I'm going to explain to you how to do the number of drops per minute. So basically, you can just use your calculator and do this. You should get should get 31.25, which is also near impossible to calculate because you can't calculate partial drops. So you're going to just round down. And you get 31 drops per minute. So what you're going to do is you're going to, it's illustration time. So you're going to stand next to your bag with your watch, and you're going to count out for 15 seconds. You're going to divide this by 4, roughly. And you're going to count out for 15 seconds what you need to get, how many drops you need to look for. So once you use your roller clamp to get about that, so your roller clamps here, you're just going to roll your wheel until if you roll it up, it'll go faster. If you roll it down, it tightens around the tubing, so it's going to drop a lot slower. So you roll it kind of in between, like a medium. You're trying to find that happy medium to where you get the correct number of drops per minute. So you calculate, you count for 15 seconds. Once you kind of ballpark it, that's like your rough estimate, then you kind of fine tune it to be 31 drops per minute, and you will count it out for a full 60 seconds to make sure you get 31. So that's basically how you calculate the number of drops per minute manually. So we're going to do another one that's a little bit different. Okay, this one we're going to calculate the number of drops per minute as well, but we have a completely different setup going here. This patient is just getting 1 liter of normal saline over 24 hours via micro drip. And if you'll remember, the micro drip has a drip factor of 60 drops per milliliter. So we set this one up the same as the last one, only we're going to substitute actual milliliters here. So 1 liter is 1,000 mLs. And we're going to multiply by our drop factor here, just the same as before. And this is where it gets really, really tricky. So on the one before we put minutes here, we have to do that again. So you multiply 24 by 60 to get the number of minutes in 24 hours. And if you're working along with your calculator, you should have gotten 1440 minutes. So working that out, you get a completely random number again. You should have 41.6 repeating, so 41.66666. And again, you can't figure that out. So because it's 6, we're going to round up to 42. And we get 42 drops per minute. So again, we're going to use our roller clamp and our drip chamber to figure out, do a rough estimate with the roller clamp, probably 12.5 drops per 15 seconds. And once you ballpark that, count to the full minute and make sure you have 42, and then you've done that. So this next problem, okay, so this next problem can be used if you are trying to figure out what time you need to go back into your patient's room to change a bag out, kind of anticipating needs as far as that goes. So in report, you get that there's 200 milliliters left in a 1 liter bag. the patient's getting this fluid at a rate of 80 milliliters per hour. So at what time will you need to go back into the room to change the bag out to anticipate those needs? So this one's fairly simple, fairly straightforward. You're going to put the the amount of fluid that you have over the rate. And once you cancel that out, you get 2.5 hours. So you will need to go back into your patient's room in 2.5 hours to change out their fluid bag. So, you know, you can have it ready and then just go in, anticipate your patient's needs. You may even be able to keep them from having to call out and say that their pump's going out. So okay, so this next problem, you're going to calculate the number of milliliters per hour that you need to put in your pump. So this particular problem, your patient's on a regular insulin drip, continuous infusion, ordered at a rate of 20 units per hour, and the available insulin preparation from the pharmacy is 250 milliliters. That's got 100 units of regular insulin in it. So we're just going to calculate this one. This one's a little bit simple as well. So we have 20 units ordered. And we're going to put that over 1 because it stands alone. And it comes 250 mLs with 100 units in it. So you just multiply 20 by 2.5 because this is basically 2.5, and you get 50 milliliters per hour, which is what you can plug into your pump. And so that's your rate, is 50 milliliters per hour, and your available dosage or your volume to be delivered is 250. So this is your rate, and that's your volume in your pump. Okay, so this next one is definitely a weight-based calculation because you see kilograms here. There's also a bit of calculation where you've got to go from milligrams down to micrograms because this is your ordered dosage here. We're also going to change it to milliliters per hour so you can plug this in the pump and do it that way. This drug, propofol, is an anesthetic, and you do not push this as a nurse. So nurses are allowed to hang this drip on a pump and give it, but this should not be pushed by a nurse unless you're a CRNA or an anesthesiologist. This should never be pushed. So the first thing we're going to do, I'm sorry, I also forgot this. Your patient weighs 168 pounds. So your patient weighs 168 pounds. You're going to divide by 2.2 to get number of kilograms. And you actually get 76.36. For our purposes, your patient weighs 76.4 kilograms. Okay, so now that you have that, we can go ahead and plug that in here. So 10 times 76.4 equals 764 micrograms per minute. So now what we have to do is multiply this by 60, which is the number of minutes in an hour. So there's 60 minutes in 1 hour. and we get some ridiculously huge number, 45,840 to be exact micrograms per hour. So that's great. What do we do with that? Well, the first thing we're going to do is get rid of this microgram. So when going back up to milligrams, we're going to divide by 1,000. I know that you guys remember that we multiplied before, but we're going back the other way now. So we're going to divide, and what you get from that is 45.84 milligrams per hour, which is a lot more manageable than the other. So now we're going to figure out how many milliliters that we need to put. We're going to put this over 1 because it stands alone again. And we're going to multiply by. And remember, we always put the total amount of the fluid available. And then we put the milligrams on the bottom. And you'll notice something fairly quickly here. This is 1. So basically you just multiply it by 1. So the answer is 45.84 milliliters per hour. So you can plug this in your pump as your rate, and 250 mLs is your volume to be infused. So you just plug that into your pump and you're good to go. Alright guys, so that's all for the IV calculations. If you have any special requests or anything you'd like to see, please leave a comment down below or shoot me a message. Thanks for watching guys, bye.